Hello, welcome to Learn Homeopathy. So last video we have discussed about the what are the PQRS symptoms where to be considered in the cases where we are going to find difficult cases like very chronic cases. So we are going to that first part of that is the mental generals PQRS. So mental general PQRS are very important in finding a case where we have to understand about the which are the most peculiar symptoms to be observed in the patient. We have to extract the peculiar mentals. Like first peculiar mental is the mental general alternating or associated with the physical generals is the one of the symptom like when perspiration anxiety during irritability during noise. These are the some of the symptoms or examples. And the next is the symptoms of a syphilitic nature or symptoms of a psychotic nature of mentals are very important. If the case is a syphilitic, and we have to take a must and should take a syphilitic mentals as a PQRS. If the case is a psychotic, and there you have to take a syphilitic. If case is a psoriatic, in the psychotic mentals PQRS to be taken. So this is a second thing, and the third is the cause of the mentals, like a emotional cause of the mentals is a very important, where the exact cause has to be recent one. If it is too far old we cannot consider, but a recent cause is considered, like a delivery, during pregnancy, if the mother has got more mental grief or humiliation or anything shock like things is considered like that. In the chronic and chronic diseases you can consider the such mental and emotional cause can be considered as one of the PQRS symptoms of the uh, cases. And the next is the mentals alternating with other mentals, like anger alternating with sadness, weeping alternating with sadness, grief alternating with irritability and all. Like those are the some of the symptoms we can understand. Like other mental causes we have to consider like thought process. In that we have to consider the sensations, so which are the different sensations we have to understand, the different type of sensations we have to understand. And in that fear, what are the type of the fear we have to check. And delusions we have to identify, like which are the syphilitic delusions are very important, and psychotic delusions are very important. Fear of a syphilitic and psychotic fears are very important. You have to find out those things. And also in the thought process you can think of also the other like repetitive phrases, like bipolar diseases where repetitive they are doing in that syphilitic nature which is associated, that also you can take the frequent nature. And next, one more thing is the dreams, like a syphilitic dreams and psychotic dream. If the case is a psychotic, you can take syphilitic. If case is a sorry, psychotic dreams are very important. I must and should be there. So these are the some of the mental PQRS, and I'm going to tell you one or two cases of autoimmune disease of psoriasis which are cured with the mental PQRS. One of the age around 80 years old man had come to us, and we have started with the case taking. It was a long history of psoriasis was there. Initially it was very mild, and after the death of his wife, he started very much sad, and very grief was there. And his psoriasis was increased, like a lonely feeling was started, and that was given him a more sleepless, so he unable to sleep because of thinking, and the sleeplessness caused him more aggravations and all. So there was other symptoms was there, foreshaken feeling was there, and he was very much sensitive about the children's grandchildren's and all. And the another symptom was that he is very sympathetic to other poor people. He used to give his pen pencil books and all he used to give. These are some of the rubrics were considered. Some was selection of the remedy was done on the basis of a kingdom. So there was a sensitivity of a patient was considered, and he was considered as a plant kingdom. We have to consider because the remedy was coming from the sensitivity was very important. So sensitivity is the theme of Shankarans is the plant based. So we have to took up opium. Opium 200 was given. patches of the psoriasis, itching was reduced, and he is mentally feeling better. The main thing is that mentally feeling better is very important. And the next was the thing is after 2 to 3 months, his patches were better by 50%. He was feeling better, and his sleep was much better, and he was sleeping quite well. After a year of a follow-up, same there was not any repetition of the opium was there. After 1 year, we have examined him, and there was 90% of the patches were better, but only one mild relapse was there in the winter. Then again one dose of opium was repeated, but after 2 years of follow-up, he was completely all right. He was enjoying his life, and he was sleeping better, and his mentals were fine. And the next another case was there, the psoriasis of the legs. So psoriasis, he was around aged around 38 years old. He was working in the Dubai, and he came to India, and he had a very otorrhea was there, and he was a deafness because of otorrhea, and he has started his eruptions, and we taken his case, and in that we found some of the mental peculiar, like mental peculiar psoriasis, where he was very irritable when there is a noise is there. So noise causes him irritability, and the sweating causes the irritability, and he cannot tolerate the hot heat weather. So he was very much hot, and sweating is was causes the irritability, and noise also causes the irritability. These are the PQRS was taken, and some of the other PQRS, like he was a very impatient. He wanted everything fast, so he was very impatient, and psoriasis patches were there, and very cracked and dry cracked were there, and there was a winter aggravation was there. That was a peculiar of the physical general. So those are considered, and we have given Arsaid 201 dose, and his patches were better, and his irritability was come down. After 3 months of follow-up, he was much more better. After 6 months of follow-up, his patches were around 60 to 70% better, and he was very much fine. Patience was there, and his patches were very good. No, there was no itching was there. And after a year of follow-up, there was no relapse of the patches, and the treatment was continued. And you can see his images, and this was a cases we consider after following the mental generals PQRS were considered in both the cases, and given which are the autoimmune diseases are cured with the homeopathic medicines completely. We'll discuss the further cases and about other PQRS in the further videos. Thank you very much.